We have made amazing strides in both the diagnosis, screening, and treatment of gastroesophageal reflux disease, and specifically Barrett's esophagus over the last 10 years. We have non-invasive and minimally invasive therapies that allow us to detect early cancerous changes and eradicate them and get rid of them before they become a problem. Things have changed for the better, and they continue to change with improved technology as we move forward. So I'm extremely excited about where we're at today and think that we're doing amazing work for our patients, and I look forward to seeing what's to come in the next 5 to 10 years.
So we're trying to raise awareness of Barrett's esophagus and the fact that heartburn is not innocent. I think that's maybe the key message. If you're having daily heartburn, maybe you should seek some attention. It's not something to be brushed aside. Availability of endoscopy, it's just not possible to scope everybody. So we have to figure out who should be scoped, and we're trying to do some knowledge translation with our primary care colleagues to get that message out. I think it warrants further support from the Ministry of Health. And in fact, Cancer Care Ontario has put that on their guidelines now. We now have a guideline for esophageal cancer starting back at Barrett's. So we have included that recommendation that patients should be able to get radiofrequency ablation to prevent progression to cancer.
There are guidelines through the major GI societies in the United States that talk about both diagnosis, management of gastroesophageal reflux disease, when to refer patients for screening, and then the management of Barrett's esophagus itself. But there is a significant lack of these resources in Canada, which is why CDHF has taken the liberty of creating this awareness campaign. And so I think we're definitely now moving in the right direction, making both patients and primary care doctors, as well as all endoscopists, more aware of Barrett's esophagus and the pathway in terms of referring patients. Cancer Care Ontario also has done excellent work in both prevention and management of esophageal cancer, and so I think we are moving in the right direction, but there is a lot more work to be done.